Hello, I'm Jeremy Fernandez. Tonight on The Virus, back into lockdown. Victoria's spiralling figures prompt a law and order response. Plus, the US hits a new peak for the number of infections in a single day. But first, hundreds of thousands of Melburnians are in isolation again. Victoria has now recorded 17 straight days of double-digit case increases. More than 60 have been registered each day over the last 5 days. Some of those have been traced back to hotels where international travellers have been quarantined. Family gatherings are also being blamed for the community transmission. Authorities are warning all Victorians to get tested and to stay home if they feel unwell.
I know it is frustrating, I know it is very challenging, and people would prefer not to be in the circumstances we are in. I understand that. We all desperately want this to be over, but we've got to get on top of this spike. We've got to get on top of these unacceptably high case numbers.
So, just how much of Melbourne has been confined? Bridget Rollerson takes a look.
Residents in 10 postcodes covering 36 suburbs in Melbourne's inner north and west are going back to stage 3 restrictions for at least 4 weeks. The only reasons to leave home in a locked down area are for work and school, care and caregiving, exercise and buying essentials. If you leave the zone, the rules still follow you. You can't go to a gym, cafe or social gathering outside your zone, and outsiders should avoid going in for anything non-essential.
Well, one of the biggest concerns is the growing rate of community transmissions in those hotspots. Overall, more than 350 cases in Victoria have been acquired locally from an unknown source or are currently being investigated. 160 of those have been identified over the last 6 days. Authorities are investigating whether those recent cases could have come from a single source.
So there were tapering off of cases, and then now the cases have gone up. So there's a number of things that can cause an outbreak that looks like this, and that can be multiple introductions or a single introduction that causes multiple outbreaks. One of the possibilities that can do that is a person who is particularly infectious who attends multiple areas or multiple places.
And we're seeing just how quickly the virus can jump out of those affected areas. 2 people who were quarantined in Melbourne tested positive when they arrived home in New South Wales and the Northern Territory this week. One of them went to work at a Woolworths supermarket in Sydney. 50 staff there are now in isolation, and anyone in the area who shows symptoms is being urged to get tested.
It certainly is a critical issue for us. If you have any symptoms at all of a cough, cold or flu, anything that you would wonder about, then go and get tested.
So what is the risk an interstate traveller could be spreading the disease? Michael Slezak explains.
News that someone in your community has had a positive test result for coronavirus can be scary, but infectious disease experts say several studies help ease these concerns. One Korean study looked at 285 people who had coronavirus, then tested negative, but later tested positive again. They traced 790 contacts of those people and found 27 of them had the virus. But of those 27 people, 24 already had it, and 3 had other likely sources of infection.
But just to see if there was any chance that maybe they'd missed something, they said, can we take any of this sample and show that it's infectious by letting it multiply up in effectively a test tube with cell lines? And the answer again was no.
Another French study found that although positive test results could be seen for up to 20 days after infection, people didn't seem to be contagious for longer than 8 days. Because of studies like this, the World Health Organization advises that positive test results weeks after infection are not a sign the person is contagious. Virologist Sasha Stelzer-Braid agrees the virus in these people is probably inactive.
The PCR test that they use, it picks up really small parts of the viral genome, but it's unlikely after a long period of time and after symptoms have resolved that that virus is there in its entirety and that it's infectious.
Science providing some comfort in a worrying time.
So experts are watching the Melbourne outbreaks closely to ensure the situation stays manageable. Earlier I spoke with Dr. Norman Swan and Professor James McCaw, who was in Melbourne's northwest.
I'm surrounded almost by lockdown postcodes and suburbs. But a month ago I could see that people were starting to interact a little bit more. And in the last 2 weeks, at school drop-off, when I drop off my child at school, I was really pleased to see people a little bit further apart, clearly noticing the change in the advice and the epidemiological situation. But look, it does feel a little bit like March here again, apart from the rain outside.
What is it about the situation in Melbourne? We get this question a lot from our viewers about why it is Melbourne is seeing this outbreak in a way that cities like Sydney, for instance, which has similar sort of cultural diversity and population density, not seeing that sort of outbreak.
So this is a classic characteristic of viral transmissible diseases. There are a few people who spread it a lot of people who get it don't spread it much at all. It's dominated by stochastic random effects. So it just happens for various reasons to have got going in Melbourne. A few months ago, there was a bit more activity in Sydney. So it's a little bit like an earthquake. You know they come, you know how often they might come, you know what they look like, but you never quite know where it's going to strike or what it's going in detail, how it's going to behave.
Dr. Swan, a lot of viewers are wondering how concerned they should be about the scale of this outbreak in Victoria and the prospect of it spreading to other parts of the country.
Well, I think that the worry is in Victoria at the moment. And yes, we've had 2 cases allegedly leaked from there, one to Northern Territory, one to New South Wales. So it's still at a low level. And so here's the good news, which James can amplify on. One of the key statistics to look for to see if they're missing much virus is their positivity rate. In other words, of all the tests that they're doing, what percentage are positive? And James can correct me on this, but my understanding is it's still well under 1% in Victoria. Now, that's good news. It sounds like waste, but it's not. It's good news because if it was high, it would mean that there's a... So it means, cut a long story short, it means they're not missing many cases if the positivity rate is low. If the positivity rate was high, it means that they're finding a lot, even though they're doing a lot. So they're doing a lot, not finding many, means there's not a lot there. Professor
McCaw, I'll get you to weigh in on this question of how worried people should be, particularly outside those hotspot suburbs in Melbourne and in other states and territories.
So I agree with Norman that while this is a big event for Australia, it's by global standards still a tiny number of cases. I mean, look at the US. It's recent. It's reporting 50,000 cases per day, and we're nowhere near that. But yes, these exponential growth has a habit of getting away from us. All of that said, we don't anticipate a large amount of seeding of the virus into other states and territories because the numbers are still so low. But so we shouldn't be alarmed, but we still need to be very vigilant about our behaviour so that if in the unlucky situation and even the unlikely situation that it does pop up somewhere else, in New South Wales or elsewhere, that we're ready to respond and we're not going about our daily lives in a way that means it would spread more quickly. So keeping 1.5 metres apart, even as society reactivates, is really an important message.
The place that's the most dangerous place is the home. This is a virus that starts in family clusters, weddings, funerals, birthday parties, people come together. And whilst 1.5 metres is the ideal social distancing, if you're in somebody's lounge room, even if you're keeping 1.5 metres apart, if you're there for an hour or two and singing happy birthday and laughing and joking, which I'm not...
That's a lot of droplets in the air.
It is a lot of droplets, and social distancing becomes less important as physical distancing loses its effect the longer you're there. So you just got... And the more people you pile into the front lounge, the higher the risk is that somebody's just caught it at random.
A number of people have asked us about this notion of a super spreader. We're yet to get to the bottom of where this outbreak originated. But we know that Victorian authorities are looking at this idea of a super spreader, that it comes down to maybe 1, maybe 2 people. What can you tell us about that?
Well, there's 2 aspects to super spreading. One is what James alluded to, which is... let's say that you're following the rules and you're staying socially and physically isolated from other people. You go to work, you come home, you don't mix with a lot of people. Let's say that you catch the virus. You're unlikely to pass it on to somebody else. It's going to disappear from you without passing on, possibly to anybody at all. But if you're really social and you've got a big family, or you go to the pub, and you're mixing with a lot of people, you will look like a super spreader, but you're just somebody who's social and you're passing the virus on. And if you're a loud speaker and you'd laugh a lot and you'd sing, you know, these are harmless activities, but you do all those things, the virus comes out in larger volumes. And so you don't need anything unusual biologically about you to be a super spreader. You just got to be social and with a loud voice, in a sense. I'm oversimplifying it grossly. Now, they do think that there are people as well who do shed virus more easily, and it's something to do with their biology. In other words, the virus doesn't stick, or once the virus is in your body, you produce more virus comes out of your respiratory tract and so on, and more likely to go into aerosols. And I don't think anybody has really pinned down what that is, but there almost certainly are people who do spread more than others. And in influenza, children are known to be super spreaders. So children, but that's almost certainly also a phenomenon of kids. You know, they've got runny noses, they're spreading things everywhere, and they're running everywhere.
They're touching everything.
Yeah, so it's kids' behaviour as much as children. But one of the reasons in an influenza pandemic that they close schools down first is that kids can be super spreaders. But James knows a lot more about this than I do.
James?
Well, it's absolutely true that it's a well-known feature of influenza that children are the drivers of transmission. And really importantly, children who get influenza are often severely infected. So there's a clinical issue there as well. And it's a little bit of an enigma with these coronaviruses. So the current one we're living with, but also SARS, that children are, for a variety of reasons, only partially understood, just less of a driver of the epidemic. Of course, no one is without risk here, and children can transmit it. They can fall ill, but typically it's COVID-19 is a disease of transmitted by young adults, and the clinical issues are in the older age groups.
I got a really good question by email during the week from a viewer asking why, when we report on various countries and how they're doing with bringing down their curves on coronavirus, we talk about the numbers of infections and numbers of deaths and not in relation to their population. So numbers of infections and deaths per million, say. Do you have an explanation for that and how easy or difficult it is to compare apples with apples, countries between country to country?
Yeah, I can. So it's an excellent question. And the answer comes on the back of something that's really quite unpleasant that I'll have to start off with, which is we're in the very, very early stages of this pandemic globally. It feels like we've been in it for the long run, but we're at the very, very early stages. And at the moment, the virus is spreading from person to person, but the vast majority of people on all of the planet Earth, and certainly in Australia, are susceptible. And so the virus, we're saying it's got this reproduction number of, say, 2. So when one person infects 2 and those 2 infect 4 and so on, the virus there's no visibility or information on how large the population is. Only once you get up to billions of infections across the planet can the lack of susceptibles come into effect. And so the virus spreads independent of the size of the population at the moment. And so it doesn't spread faster in a larger population. It doesn't spread slower in a small population.
Which is why we've got to be worried in Australia, because it becomes very large numbers.
And it's also why we therefore we should report just raw numbers, because the virus hasn't yet infected enough of us to have its transmission modified by the population size.
And even in Sweden, which everybody talks about, it's probably no more than 6 or 7% of the population has been infected.
Yeah, which is a lot lower than they were expecting, I think, wasn't it?
And a lot of people have died.
Yeah. All right, Norman Swan, Professor, continue.
I was just going to say, and this is the really worrying thing about COVID is that with that natural reproduction number of around 2, we're going to see, unless a vaccine cuts everything short, we're going to see 60 to 70% of the world's population infected over a long period of time. And until that's up to 30 or 40 or 50%, the right thing to do is just report raw numbers, and they're not going to look pleasant for quite some time.
So let's take a look at how the picture looks nationally right now. The number of daily confirmed cases hasn't been this high since mid-April. Victoria is now the main driver of this increase. Nevertheless, the government's medical advisors are largely optimistic about the national response, saying even these outbreaks in Melbourne are within expectations.
Right from the outset of this national response to the pandemic, we advised that we expected outbreaks to occur, that we would need to continue to test, to trace, and if necessary, to have further lockdowns occur.
And as you'd expect, the number of active cases, that is to say the number of people known to currently be infected, has jumped substantially. There were only 190 nationally this time last week, and now there are more than 450. The case in the Northern Territory is the first there in more than 80 days. The low numbers in some states and territories are prompting the further easing of restrictions, though. In Queensland, more people are allowed at pubs, homes, weddings and funerals. The size of the venue is the only limit. Larger venues are capped at hosting one person per 4 square metres. Queensland will also open its borders on July the 10th, but like most states, it won't allow Victorians in. More human trials of a potential vaccine have begun in Australia. If it's successful, it could be available from next year.
Some might say he's crazy, but as a pharmacist, Ian Tyndall knows the importance of vaccine trials.
Well, if not me, then who, right? Someone has to do this, so why not?
The 61-year-old grandfather of 2 is the first person to be injected with the Australian-developed vaccine candidate COVAX-19 and says he's not worried about the risks.
I drove down the freeway this morning, so to me that's hairier than this.
A team of 14 developers from Flinders University have been working on the potential vaccine, which is based on a synthetic protein, meaning it doesn't require patients to be injected with the live virus.
So you can't get an infection from our vaccine.
A blood sample will be taken from the trial patients to see whether the dose induces antibodies to kill the coronavirus.
If it's proven to be successful, could be available as early as next year.
The United States has already expressed interest in purchasing the vaccine. The country's been slammed for hoarding almost all of the world's supply of the only drug licensed so far to treat COVID-19. It's not life-saving, but remdesivir can cut COVID symptoms from 15 to 11 days, and the US has struck a deal directly with the manufacturer.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
The global infection rate shows no sign of slowing down. Almost 11 million cases have now been recorded and more than 520,000 people have died. The outbreaks in the US and Brazil are the most severe. However, the number of cases in India has now passed 600,000, with the infection curve rising sharply over the past 2 weeks. This chart shows the number of deaths per 100 confirmed cases, and this gives you a sense of how a country's health system was prepared and then coped when the outbreaks have hit. Mortality rates in the UK remain at 14%, well ahead of other countries badly affected by the virus. Meanwhile, the US is now approaching 3 million confirmed cases with almost 130,000 deaths. And it set a new record for the 5th time in just over a week, with more than 55,000 cases identified in a single day. Florida alone contributed 10,000 of those cases. A number of states now reversing plans to reopen ahead of the Independence Day celebrations on the 4th of July. America's top infectious diseases expert says he expects to see 100,000 new cases each day before the situation starts getting better.
The numbers speak for themselves. I'm very concerned and I'm not satisfied with what's going on because we're going in the wrong direction if you look at the curves of the new cases. So we've really got to do something about that, and we need to do it quickly. Short answer to your question is that clearly we are not in total control right now.
Now, if you want to see more of that conversation with Professor James McCaw and Norman Swan, just check out the ABC News YouTube and Facebook channels. Stay safe. Thanks for your company. We'll be back next week. Bye for now.